What will your last 10 years look like? Will you be quick enough for a game with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide. The average people will spend their last 10 years in sickness. Change your future that will make your health last. Here on The Christ Farmacy, your key to health and vitality.
This program aims to inform and provide solution to your health queries.
It provides valuable health information and embraces a holistic approach to wellness by addressing physical, mental, social, and spiritual health that aims to empower individuals of all ages and backgrounds to take charge of their own well-being.
We will help you find out answers mga kapaglaom. Maayong adlaw sa iyong tanan. This is Kay Hespersera.
And I am Ray Tagalogon. Welcome to our weekly health program, The Christ Farmacy, the key to health and vitality.
The Christ Farmacy, your key to health and vitality.
Weight gain, irregular menses, hairy chin, acne. Have you encountered any of these mga kapaglaom? I would like to welcome all of you sa atong ika-21st episode with our guest today.
Sakto ka na kapaglaom, Ray. And we would also like to encourage everyone, we're about to start, is to please join and send your answers or questions mga kapaglaom sa ato ang topic na po new episodes. If you have also your concern, just message us to our hotline 0970-077-7734. Again mga kapaglaom, it's 0970-077-7734. And since another episode na sad mga kapaglaom mga ato ang makatunan karon, let us make ourselves comfortable and share our live stream karon sa tunga family and friends.
Mga kapaglaom, it is with great pleasure that we welcome back Dr. Cherry Lou Nermal Fernandez, a distinguished expert in OB/GYN and a specialist in lifestyle preventive medicine. She will share valuable insights on the topic at hand. Please join us, mga kapaglaom, as we welcome Dr. Cherry Lou Nermal Fernandez. Good morning once again, Doc.
Good morning, adlaw sa imo.
Good morning, kapaglaom.
Okay,
Kay
yes.
and kapaglaom Ray. I'm sorry, I'm not very good at this, but good morning everybody. Welcome to our segment this morning, no? Lipay kay ko nga makaapil ko diri para makatudlo sad ko og unsay ako nabalaan.
Yes, Doc.
Alright. And makakapaglaom usa sa gikalangkuban no, sa ato nga programa is ang panghimang, no. And speaking of that, it will never be complete sa ato nga programa or discussion today if we will not seek and listen to spiritual health tips. So unya makapaglaom ang paminawan nato, no. So the Christ Farmacy teaches you and hopes to help you about natural ways and to point us to the one and only source of healing, the greatest physician and savior, Jesus Christ. So alang sa pagsugod akong ginaham-ang niyo si Dr. Fernandez to lead us our opening prayer.
Let us bow our heads. Loving, gracious Lord, the author of our lives, thank you so much for being there for us all the time. Thank you so much for not allowing us to always stay where we are, but encouraging us to grow in every aspect of our lives. Especially, Father, you have given us the light so we can take care of our bodies. We know that our bodies are the temple of God, and we desire to be able to present our bodies holy and acceptable to you. So please help us, Father, as we go through our segment this morning. We hope and pray that you will open the minds of our hearers and also give us the wisdom to impart what we need to do. Thank you so much, Father, for Jesus' sake. Amen.
Amen.
And thank you so much, Doc. Well, we have a crucial topic to learn that affects millions of individuals worldwide. Tungod sa atong kabisi, makapaglaom, dili nato mapansin ng iyang mga simptomas. And as we break the silence and gain valuable insights into this often misunderstood and overlooked condition, our topic title today, mga kapaglaom, is Girls Focused on PCOS. So, to listen this topic, let's take a look, mga kapaglaom, for our lecture. Let's watch this.
Welcome back. I am very excited that we're going to study another important topic, polycystic ovarian syndrome. Agoy, kaninga problema common ni siya. But it's very important that we studied already the normal anatomy of the female reproductive tract. We studied the physiology. We also studied menarche, first regla. We also studied menstruation. You can always go back and watch these shows. But this one today, we're going to discuss polycystic ovarian syndrome. Polycystic gani, poly meaning plenty. Cystic, daghan cyst. Nya ovary, sa ovary na siya, nya syndrome, daghan kay siya manifestations. But really, polycystic ovarian syndrome is not that the ovaries are cystic, okay? Dili na tinuod nga cyst. But we're going to talk about that. So we're going to deal with it now. Now, welcome again to Because I Am Eve, polycystic ovarian syndrome. It is important that we know that the Lord is there for us. I am Eve. I made the mistake. I ate the fruit and I'm suffering now. I have polycystic ovarian syndrome. Lord, help me, di ba? He says, I am here for you. So when we have polycystic ovarian syndrome, we don't need to be problematic because we know God is there. He's going to give us rest even in our trials. So what is polycystic ovarian syndrome? Polycystic ovarian syndrome is a very common condition with serious physiologic and pathologic health consequences, commonly an ovulation. Okay? Ibig sabihin nun, wala ga ovulate siya. Walay itlog. Wala siya ga release of ovum. So the problem is, di siya mabuntis kay wala man siya ga ovulate. Kay tungod, ang ovaries polycystic. Okay? So, this PCOS, kung sabihin mo, it affects women across the reproductive lifespan. Pwede bata pa siya, pwede medyo na siyang hapit na menopause, but across the reproductive lifespan, women are affected here. And it is associated with pregnancy complications. Kung mangani ma-pregnant siya, na problema ang pregnancy, including gestational diabetes. Kay kaning manggong PCOS, kung atong i-discuss later, ma-prone ang babae nga mag-diabetes later. Ma-prone po siya nga mag-hypertension siya habang pregnant siya. And then ma-prone po siya nga daku iyang bata. So kaning PCOS, dili na siya basta-basta, okay lang, wako garegla, may nalanggid po, kay dili na ko magsigig regla. No, you cannot let it go, you know? Because it's not only that lisod ka mag-pregnant, it's not only nga infertile ka, pero naay consequences sa nga wala ka ga ovulate, no? When I said gani earlier nga, kung wala kag ovulate, wala kay estrogen, nay problema sa imong brain, nay problema sa imong bones, nay problema sa mga organs and systems that are affected by estrogen. So you want estrogen and progesterone, important hormones in your life. But if you're PCOS, dili na siya normal. Dili ka ay normal, wala kay estrogen kayo, wala po progesterone kayo, pero ang nasa imo ang another kind of hormone. So you don't want that kind of hormone, kay mag-suffer ka. Anovulation ang tawag sa problem sa PCOS. So we go forward with this one. And PCOS is associated with excess weight gain. Also sudden weight gain, which in turn exacerbates the health burden of PCOS. So habang nagatambok ang babae, habang naga-gain weight siya, gakatambok siya, ga-release siya og kasi ang fat cells manggod, habang gadagan na siya, ang fat cells manggod makaproduce og low kind of estrogen. So, the brain's thinking, you're ovulating, bisag wala ka ga-ovulate. you're growing bisag wala ka ga-grow. Kay naamang goy lahi nga hormone naga superimpose sa imong fat being made. And then when you're enough, and when habang gain kag weight, chronically inflamed ka, daghan kay ang imong body ga think nga ga flight and fight ka kay inflamed ka man kay daghan man kag fat. So it's a very what do you call this? It's a rainbow or a big spectrum of problems when you have PCOS. It's not only nga wala ka ga regla, affected ang uban system sa imong body, daghan ang consequences ani. So we really need to talk about this and to try and understand what are the problems associated with PCOS. Okay, we go forward. It is the leading endocrine disturbance that affects especially young women. Okay? So, ang endocrine system nato na maunangga produce atong hormones. The leading cause of hormonal problems, endocrine problems, is PCOS. It is that common. It is very common. And it is the leading cause of infertility with a high prevalence rate. Ibig sabihin nun, common siya. Okay? It is very common. More common than we think. And it's becoming more and more common. Kato pagsugod pag yun na ako practice, pagsugod pag yun na ako pag residency, dili pa kay siya daghan, no? Makadungog ka PCOS, kanang talagsaon na lang na mo makita. Pero karon, agoy, halos na. Because all of us are affected by the kind of life we live now. Stressful, pagkaon, walay exercise, kusog kay kanang wala ga sakto og follow sa loss of health. They can affect your endocrine system, and your endocrine system can really can suffer, and you can have PCOS, no? So, it is strongly genetic. Kaliwat po di ay ni siya. It's strongly genetic, and the different components may be passed differentially. O, ibig sabihin nun, sometimes your mother is really PCOS. Not all the daughters will have it severely. Some mild, some grabe. So it's passed. It's passed and caused by different things. It manifests differently. So PCOS can manifest in different ways. It's sometimes a frequency, expression, and timing makes diagnosis difficult. Kasi sometimes, mas daghan og problema kaysa sa ang isa ka sister, dili kay grabe, ang isa ka sister mas grabe. So, it's really different. And 20 to 30% have polycystic disease are diagnosed by ultrasound. You cannot diagnose PCOS specifically, definitely, unless you have an ultrasound. 80% have one or more symptoms of the syndrome. It is a syndrome. Kung syndrome gani daghan siya manifestation. Dili lang anovulation, dili lang infertility. Na siya'y uban nga manifestations which we will talk about. 80% of women with normal ovaries may have one or more symptom of the problem. So you don't want to when we know when we know the manifestations of PCOS, we have to think serious now. We have to know, because you see, we women, we can work a lot of things, but many times we cannot work because we are disabled by our problems. Then men don't have them kasi wala man sila estrogen, wala po sila progesterone. So dili sila makasuffer the same way we suffer. We have specific problems that get in the way. Then tungod man gud hormonal siya, tungod ang brain grabe mag-bask in hormones, basta mag-irregular gani ang hormones, problematic kay tanga babae. It can keep us from working, and it can also cause our mentation or even our psyche to change. Nabayag yung mga, ay dili ko mabuntis, problematic kaayo, mga inana ba? Agoy, it can cause people to lose work, to become not so fruitful in the work they do, kay affected man sila sa ilang PCOS. And because it's endocrine, daghan kay nga systems ang the endocrine system man good is the next dictator in the body. The first dictator is our brain. The brain says, do this, do that, do this and that. Whatever. And then the hormones are the next, you know. Then if there's a vice president, like you could say. But if the endocrine system is problematic, a lot of systems in the body will be affected. We will stop for now and have a break because we're going to start talking about the manifestations of PCOS. Don't move the dial, stay there, don't change your channel. We'll stay here and we will understand why PCOS manifests this and that and why we should really learn these things because they are important. Keep staying tuned.
Meet Eve. She's not just any woman. She's a reflection of the resilience, wisdom, and strength that embodies womanhood. Her story is one of empowerment, advocacy, and the unyielding spirit of a woman who refuses to be defined by limitations or expectations. She is a catalyst for progress, challenging conventions, and inspiring those around her to embrace their own potentials. In a world that often attempts to confine and label her, Eve stands tall, unapologetically embracing her identity and rewriting the narrative with every step she takes. Join us in celebrating the spirit of Eve and women like her who fearlessly chart their own paths and redefine what it means to be whole, unbound, and truly themselves. Because I am Eve. Because she is you. Because she is all of us.
Welcome back. I'm again excited because now we're going to talk about the clinical manifestations of PCOS. How does it manifest? Unsa man ang makita nimo, unsa may mga presentation sa babae nga nay PCOS. Kay very common siya, di ba? Tapos grabe ang mga complications kung naa kay PCOS. So now we want to know so that kung naa kay mga manifestations ngayon ani, makapa-check up na kadayon, dili magdugay. Kay kinahanglan makabalugyog ka nga kung naa kay PCOS or not. Okay? So we're here, clinical manifestations of PCOS. Presenting signs and symptoms and the affected percentage of affected women. Okay? So, we will have at least to know. So, kung gani overweight ka, obesity, 41% of women with obesity have PCOS. So, imagine almost half, no? Almost half of women with obesity have PCOS. So, and then menstrual disturbances, 70%. Exactly. Uterine bleeding, kanang hormonal imbalance siya, na nagaregla na siya nga abnormal. So, 70%. So, kung manggani abnormal imong menses, dysfunctional uterine bleeding, ga bleed ka sa panahon nga dapat dili ka mo bleed, kulang imong bleeding or profuse imong bleeding, 70% ay problema na siya. Some affected ka na kay PCOS. The next one is oligomenorrhea. Oligomenorrhea, oligo means small, okay? Gamay lang ang flow, menorrhea flow, blood flow. So, kung gamay lang imong regla, ang regla man good regularly is 30 to 80 cc. Pero kung gamay lang imong regla, less than 30, murag drop lang, munang oligomenorrhea. This is the general, okay? Ganing rule of the general ni siya, kung gamay lang imong regla, most likely na kay PCOS 47% of the time. And then 19% of the time of women who do not have menses have PCOS. Can you see? Because PCOS, many of them are not having regla regularly. Pero tanawa, 19% lang gani sa wala ga regla ang nice PCOS. Pero tanaw nimo ang abnormal menses, dysfunctional uterine bleeding, hormonal imbalance, ug ang obesity, taas kayo. Tapos, some of them gani with regular menstruation, regular pa gani sila regla, pero 48%. So, it's like hiding, pero naa ay problema. Kasi bisag regular menstruation ka, 48% na pagyapoy PCOS. That will tell you that it's very important that you have your check-up regularly. Once reproductive na gani ka, once magregla na gani ka, it's important nga mag-check up yun ka. Kay bisag normal imong menses, regular imong menses, 48% of them have PCOS. Okay? And then we have hyperandrogenism. Kaning hyperandrogenism, pinakadako ni nga cause, it is 60 plus percent to 74. Ibig sabihin nun, taas kayo, 70%, like 7 in 10 who have hyperandrogenism, meaning taas og androgens. Now, androgen is a type of hormone that is specifically, kumbaga, that's the hormone, precursor hormone for male testosterone. So, ang hyperandrogenism is when you have high androgens, which is the hormone for men. Okay? So, ang kaning mga PCOS, na sila'y taas, mubo ang estrogen, mubo ang progesterone, pero taas ang ilang precursor to testosterone. Dili ini testosterone, ha? Pero precursor ni siya sa testosterone. So, sometimes they will manifest with signs and symptoms of kanang naay balahibo nga bungot, naay balahibo sa legs, murag lalaki siya kay ngano, taas man gud siya precursor to testosterone. And 73% of infertility is PCOS. So kung mag-ato ka sa doktor niya, Dok, gusto ko mabuntis, dugay na mi nagminyo, wala pa gyud kihapon mi anak. Usually 73% of them are anovulatory and they are infertile. Some 20% wala gad sila'y manifestation, pero pag ultrasound naa sila'y PCOS. 20% na. Those have PCOS even if they are asymptomatic. Wala sila'y problema. So these are the presenting signs and symptoms. We can go further. The hormonal disturbances, daghan kay hormones operating, daghan na gyud. Increase insulin. So taas ang insulin, no? Taas ang insulin. Ang diabetes kay ang diabetes type 1 wala insulin. Diabetes type 2 daghan insulin pero wala ga trabaho ang insulin. Nya na ay SHBG, steroid hormone binding globulin, na DHEA, dehydroepiandrosterone. Mga daghan kay ni siya, oh. We don't have to go through all these, but there's so many hormonal disturbances that are affected. So basta na kay PCOS, daghan kay hormones nga affected, daghan pud ang organs nga ma-affected. Munang kinahanglan nga mag-check gyud ka kung abnormal ang menses, kung overweight ka, kung di ka mabuntis, kay basig PCOS ka. And you will have problems later. So this is a very complex slide, you know? But you will see here that lifestyle there's this kanang chart diri. Sa upper left, diha na kay that's sa diet, sa imong lifestyle, makapadaghan sa androgen sa imong lawas. Okay? So, if you have plenty of androgens, it will affect your pancreas, it will affect your liver, it will affect your ovaries, it will affect your muscles, and all these things will cause all those abnormal hormones. And then, in the end, ang mahitabo, dili ka mo regla. So, not only the ovaries ang problema diri, no? Ang imong fat cells nga ga-release og hormones, ang imong liver nga ga-release og hormones, ang imong pancreas nga ga-release og hormones, ang imong muscles nga wala ga trabaho og wala ga paminaw sa insulin will all affect your ovaries, and in the end dili ka magregla, dili ka mag-ovulate, then di ka mag-pregnant. So I'm trying to make this slide a little bit it's just saying there are several organ systems that are affected when you have PCOS. Okay? So, then it will flow like that until you are problematic. Now, some more clinical manifestations of PCOS. You have possible late sequelae. Wala, nimo gitagad, okay lang walay regla, okay lang wala na buntis. Okay? And you go further and further in your reproductive life and not you think about it. What's going to happen to you? Okay? You can have continued dyslipidemia. This is a heavy word, no? Pero ang ibig sabihin no, ani, taas lang ang, what they call this? Taas ang imong mga dili maong cholesterol sa imong body. Okay? So, fatty, baga ang imong blood. Na LDL is increased. LDL is the low density lipoprotein. Kung taas na siya, prone ka sa hypertension, prone pud ka sa stroke, prone pud ka sa heart attack. Yeah, decreased HDL or high density lipoprotein, mubo na siya. Kung kanang increase ang imong LDL, decrease imong HDL, prone ka gihapon sa hypertension, stroke, and heart. The same way as when you have increased triglycerides. So when you have dyslipidemia, the fat in your bloodstream is not the right amount. This can be the sequelae that comes from your PCOS. Ibig sabihin nun, kung dili nimo at tupagon ang imong PCOS, mahimo gyud kang dyslipidemic, mo saka imong cholesterol, mo saka imong triglycerides, ma-prone ka mag-stroke, in other words. The next one is, you're prone to become diabetic. Sa tanan gyud nga disease, di gyud ko ganan maghuna-huna nga diabetic. No, 30% of women with or without obesity have even diabetes. You don't even need to be fat to be diabetic. But that can be the result of PCOS. So, wala ni mo gitagad ang PCOS, as you grow older, mahimo kang diabetic. Tapos, the next one is endometrial hyperplasia, which can become cancer later on. Kahadlok ani no, mag-dyslipidemia ka, mag-stroke ka, mag-hypertensive ka, mag-heart attack ka, ma-diabetic ka, maputuli mong tiil kay dyslipidemic, unsa ni taas imong ang imong sugar sa imong blood, nagka-problema na katanan-tanan. Plus pag yun, basi mahimo kang cancer, mahimong cancer ang imong uterus, no? Ang lining sa imong uterus. So you do not want not to address PCOS. And we also have other problems associated with not taking care of who have PCOS. So women with PCOS are at increased risk of gestational diabetes. Kung gani na PCOS sila, na nabuntis sila, oh, very happy doc, thank you doc, nabuntis ko. Pero PCOS siya. Kung PCOS gani siya, prone na siya sa gestational diabetes. Pwede siya ma-diabetic associated with pregnancy, no? Diabetes mellitus. And then pwede siya mag-hypertensive. Pregnant siya. Ang problema ni manggong gestational diabetes, dako imong baby. So ma-CS ka. Problematic na siya. Kung pregnancy-induced hypertension po, prone po ka sa premature. Gamay imong baby. So, ang problema sa imong baby, kung PCOS ka, duha. Whether tambok imong baby, ma-CS ka. Whether niwang imong baby, ma-premature imong baby, kinahanglan siya i-deliver, kay na kay hypertension, CS lang gihapon. So, problematic ang PCOS. You don't, even if you're pregnant, you got pregnant, you still have to be watchful. So, these are the possible late sequelae and other sequelae of PCOS. One without getting pregnant, and the other once you get pregnant, you can have the problems. So how do we diagnose PCOS? Okay? There are here, diagnosis is based on 2 out of 3. So we're going to look here. The first one is the sonographic evidence of polycystic ovaries. So, kung ma-ultrasound ka, makita nimo nga naay mga gagming nga cysts. Actually, I have to tell you, these are not real cysts, okay? They are eggs, they are ova that grew big but were not ovulated. So mag-persist na siya dira. So daghan kay na siya. Pag PCOS manggug ka ga-recruit permanente og ga-recruit og eggs para mag-ovulate, pero dili man wala siya ga-ovulate. Okay? And then chronic anovulation or irregular menses. So, kung ang babae mag-ato sa doktor na, Dok, irregular ako menses, ting! Maghuna-huna din ng doktor, basig PCOS ni siya. Okay? Tapos, evidence of androgen excess. Ang tawag na hirsutism, hirsut. Kanang naibungot na rin ay mga babae nga bungoton, tapos ang legs, ang hair, grabe. So, you can see here in the picture, naibungot, naibuhok diri sa iyang diri, tapos, murag lalaki na result sa male hormone, ang androgens, mura siya develop og hirsutism ang tawag ana. Other tests, because nga na siya prone to diabetes, you take the glucose tolerance test. Kay insulin resistant manggod ni siya. Mo develop siya insulin resistant, wala gapaminaw ang iyang lawas. Kay kaning PCOS manggod mura ni siya relative sa diabetes. So if you actually ang medication gani sa PCOS is metformin, which is a medication for diabetes. So they check your glucose tolerance test. Ang glucose tolerance test is paimnon kag sugar solution, glucose solution, and then after they take your blood, paimnon kag sugar, then after some time mag-see how your body reacts to the sugar you take. And kung abnormal na siya, then mag-diagnose ka nga insulin resistant ka or basig na kay diabetes. So here is a picture on the left. You can see here down the ovary with only one egg, okay? So that is the normal that's the normal itsura sa ovaries. But on the right side of that picture on the left, you have several little holes there. Those are follicles that have grown to maturity and have not been ovulated. So kung tanaw ka sa picture diya, tanawan ning mga ovaries nino, daghan kay silang mga cyst. And then murag rosary na siya sa palibot sa kilid sa ovaries. Kung gani sa ultrasound makita na daghan ka cyst towards the edge of the ovaries, like a rosary bead, the beads of a rosary, then the diagnosis of polycystic ovarian syndrome is made. So, that is the clinching diagnosis of PCOS. Now, here, general management of PCOS. Paminaw, mga girls nga, huna-huna mo, basig na mo'y PCOS. You have 4 important goals here. Is to reverse or your androgen excess. Kay daghan man kag androgeno, nagbungot na ka, nagtubo ang hair sa imong legs, nagtubo po diri mo tapos mag-hair pa ka sa chest. Mura na kag nahimong lalaki. You want to reverse the androgen para kasi di ba ang babae di man gyud na dapat magbungot. Ang babae dapat dili walay hair diri. Pero kung naman ganin hair nga outside of there nga normal na hair sa lalaki, androgen problem na siya. Okay? So we want to reverse that. When we have normal menses na and our normal cycle comes and our normal hormones come, ma-reverse na siya. Okay? So I've seen this over and over. Once we're able to reverse the hormonal problem, if we're able to check the hormonal problem, mawala na dayon tong hirsutism niya. That's the first goal. The second goal is instituting regular cyclic menstruation. We want her to go regular menses. Kaya kung mag-regular na siya, mas dali na siya ipapregnant. Kung dili, kay unsaon na nimo kung malaka pa sa whatever ang imong pagregla, unsaon pagkabalo nga kanus ka mabuntis, no? But when kung mag-regular imong menses, makabantay na kanus ang importante nga makakontak mo sa saktong panahon nga mabuntis ang babae. So we want to regularize the cycle. And then we want to restore fertility because diba it's the number 1 cause of fertility. But it's not that there's a problem in the uterus. It's not that there's a big problem over. Gatrabaho ang over ay problema dagan cyst. Gatrabaho ang uterus pero kulang ang right hormone. So dili gid kayo ma-fertile ang babae. We want to bring that back so that ma-fertile siya. And then we are going to mitigate or stop or change or make better the associated metabolic and or endocrine disturbances. Kay na diabetes, na hyperlipidemia, na hypertension, gusto nato na siya walaon. Kay kung mawala na siya, ma-check lang din ang PCOS, no? So these are the 4 important things. You reverse the manifestation of androgen excess. You want to institute a regular cycle. You want to restore fertility, ovulation. You want to restore that. And then you want to cut the mga problems associated with metabolism like diabetes, hypertension, hyperlipidemia, or high ang cholesterol. Okay? You want to fix that. Those are the main goals. Kaya kung ma-fix na ninimo, ang problema sa PCOS, mawala. No? The sequelae of PCOS, mawala na siya. So we want that. And it's very possible. We're able to do this. Magkuhan lang yun ba? Because it's a lot of organ systems are affected. The woman who is suffering from PCOS has to be very like, the needle is to the pole. Focus gina siya. Kay daghan man gud siya i-work up, you know? Overweight siya, hypertensive siya, mga like, take care of those because kung dili gani, di nato makamtan ang goals sa pag-manage sa PCOS. So we go ahead. It is important good that we know also whether the patient wants to get pregnant or not. Kay usahay, mag-PCOS siya, 40 na siya. Hapit na siya anyway, nga mag-menopause. So kung ngano maningkamot pa man ta magkuana na niya, mapabuntis ana nga 48 na siya, no? basig mag-menopause naman siya, but the management man good of PCOS depends on whether the woman wants to get pregnant or not. Okay, so if she wants to get pregnant, aggressive gyud ka. Sa panahon nga, daghan pa siya itlog, she can work things out, everything is prime. Let's just say, late 20s or early 30s, or the 30s. Muning kamot kita mambuntis na siya. So when we do that, we have to fit all 4 goals and focus and do that because you want to get her pregnant. You know, it's very exciting to have a baby. It's very exciting to see somebody get pregnant. It's very exciting to see that the health of this woman with PCOS becomes better because we're working to fix all these goals. You know, we want to make her better. Now we're going to cover principles in the management of PCOS. So, di ba, nakatay goals, 4 goals. Karon para makuha nato ning 4 goals are principles we have to take. Management of PCOS is nearly lifelong. It is a nearly lifelong, continuous gid ni. Kay ngano naman ko kay PCOS. Kung mag-relax lang ka, mubalik na siya, no? And you're going to develop the problems associated with it. So, management of PCOS is nearly lifelong process because the effects of the persist even past childbearing years. Dili man ang diabetes, pwede lang sa pregnant, dili, bisag matigulang na ka, diabetic ka gyapon, hypertensive ka gyapon, hyperlipidemia lang gyapon ka. So kung dili nimo, hunahunahon nga, i-manage gud nimo ang PCOS, kanang persistent gid na siya, para dili ka magkaroon ng sequelae. Di ba? You try your best to take care of yourself. Tapos, appropriate primary care is needed to control the systemic features of PCOS. Kaya dahil may systemic features, dili lang sa ovary, dili lang sa uterus, nasa imong blood, kay ang lipids taas, nasa imong brain, kanang irregular imong menses, nasa imong skin, nagtubo ang mga buhok nga murag lalaki ka. So, different parts of your body. So, appropriate primary care is needed to control the systemic features of PCOS so that there is only a minimal impact on the woman's life and the health outcomes. It is holistic baga. Tanan gyud nga kung asa man gani ang pwede magka-problema, bantayan yun na dira and lifelong na siya. Unfortunately, that's the way life is for us. Many times like we have problems that we have to deal with our entire lives, and what PCOS is one of them. And we can continue with the principles. Outcomes of weight management programs in women with PCOS are likely to be improved with the inclusion of behavioral and psychological strategies. So, ibig sabihin nun, some of them kasi, sobra na gid sila they really want to get pregnant, they're so stressed, din na PCOS na sila samot, PCOS na sila, na stress pagid sila, na push forward na siya. Kaya ang uban, ma-depress na lang sila, kaya tungod gusto gid sila mabuntis. Kaya ang management, involving behavioral and psychological strategy. Sometimes, mag-cognitive behavioral therapy na gyud ka. So, you have to include goal setting, self-monitoring, cognitive reconstructing, you have to think positive instead of negative, and then relapse prevention. You want to prevent relapse, so you work on it consistently, persistently. That's what PCOS needs, in its management. Strategies targeting improved motivation, social support, and psychological well-being also have an important thing as a principle in the management. These can be applied to the clinical management of women with PCOS at different reproduction or reproductive stages. So, all of this, kung bata pa ka na kay PCOS, trabaho gigana, unfortunately, it has to be all the life of the woman in her life stages because you don't want to develop sequelae. Okay? So now, we're going to stop here. We're going to continue with lifestyle. Now, you can take care of this with lifestyle. So, we're going to come back. We're going to come back for the lifestyle management of PCOS. Stay tuned because you don't need medications here. You just have to take care of yourself very well. You take care of your health and you will be able to take care of your PCOS. Stay tuned. We'll come back for you. Now we're doing the most exciting part of the management of PCOS. Lifestyle ni siya. Doable yun ni. Doesn't need a lot of money. You can work on it and it's very doable. You know? Wala pa ni siya complications. Wala side effect. Di man ni drugs. No? The first one is weight loss. Easier said and done many times. But it is important that the lady PCOS should take care. The goal is to get a 5 to 10% reduction. Gamay raman 5 to 10%. You don't have to like hit a big amount of weight loss, you know? Kasi pangit man sad pud kung dako kayo yung weight loss. It's not physiologic. Just a little bit, 5 to 10% okay na siya. Obese women should try their best to bring down their BMI. Ang BMI is how much fat you have in your blood system, right? And testosterone levels, that's the hormone of the guys, androgen. You have to work kasi pag you lose weight, your testosterone level or the hormone what do you call this? The hormone that gets to become testosterone is controlled because it comes from the fat. So when you lose fat, ang possibility nimo nga ma-produce kag androgens, mawala na siya. So you have to do weight loss. Now, exercise is very important in the weight loss management. Exercise and physical activity. Kay kita magud mulingkod lang ta magbuyod-buyod lang and thinking that no amount of prayer, no amount of fasting, no amount of dedication and meditation will make you lose weight, okay? You got to work it. You got to exercise and you got to have physical activity. So kanang mga tao nga na sa offices nga na PCOS, you got to find a way to exercise because exercise is important, no? It improves insulin resistance. When you exercise, the muscles become alive and they bring glucose into the blood, into the muscles, and your sugar comes down. So your insulin sensitivity becomes better when you exercise. 150 divided by 5, so 30 minutes lang na siya. 30 minutes a day of moderate activity. You just walk, you know? Walk for 30 minutes every day. Kanang walk nga dili, okay, anak nga walk. Kanang walk yun gani nga, anak yun. Tapos imong heart rate nagtaas yun. Kanang 20 beats above baseline. You need to be walking 30 minutes a day, real walk, dili joke nga walk. Okay? Not running, not jogging, just walking fast. Brisk walking, that's moderate exercise. 150 a week or 30 minutes every day for 5 days at least. Exercise, okay? Even without or with diet. It's very important yun. Even without diet, mag-exercise lang ka, pwede na ka mag-weight loss. Actually, mo man na ilang nakita karon. Bisag mo kaon ka, moderate lang sad po ang imong kaon. Bisag you don't change your diet drastically, basta ga-exercise yun ka, serious yun imong exercise. Morning, noon, and night. Bisag 10 minutes sa morning, 10 minutes sa noon, 10 minutes sa evening. Basta bala-bala yun nga brisk walking para imong heart rate magtaas pod. But when you do that regularly, after every meal if you can, then you will be able to control your weight. Your weight will come down. It's very important because exercises works with your HPO axis. Very important. Then diet. Okay? So diet, I want to eat chicken, I want to eat fish, I want to eat everything like that. You have to tailor. You have to you have to control. Because it's important, dude nga, dili rasa po ka nagburas kag kaon bisag unsa na lang. No, you have to choose nutritious food. Because you see, when you're going to get pregnant, your baby's life depends on your health. So, dili ka magpatakag kaon, kay ang imong gipundar nga nutrition in your body when you want to get pregnant is important. Kaya dapat you feed your body with the right food, di ba? Kung dili po kaganuhan mag-pregnant, pero gusto gyud ka nga mag-healthy, kaon gyud kag sakto. Yan nga nung maglisod man gyud tag kaon sakto. Kay lami man gud pud kaayo ang mga dili mao nga pagkaon. Munang kakaon tag daghan kay di man mao. Anyway, if you could have a lot of fiber in your diet. Fiber rich ang tawag na. So daghan gyud imong vegetables. vegetables and fruit, daghan yun na siya. And dapat ang imong rice, kung pwede lang yun, whole grain rice na siya, unpolished rice. Lisod man lisod man magkaon og polished rice, lisod pud na siya pangitaon. Pero makita na siya, you can buy that and it is better for you kasi fiber rich man na siya. Niya ma-absorb niya ang excess fat sa imong tiyan o sa tinae. So it's better really for you to control your diet. As we go forward, no? So we already have weight loss, we have to exercise, we have to control our diet. Now we're going to do supplementation. So sometimes, Manggod, we need supplementation because we cannot get diet that's always balanced. So if you can do vitamin D, okay, you can go out in the sun and be exposed to the sun to get your vitamin D. That's the best way to get vitamin D. You don't need to supplement if you're out in the sun. It is very important for you to get vitamin D because deficiency in vitamin D usually is part of the pathogenesis or the development of PCOS. You know, vitamin D, daghan ba yun? Epidemic naman ang vitamin D deficiency. Kaya mga tao, hadlok man mo gawas sa gawas, kay magpainit sila, ito man sila niya, di na sila sexy, di na sila tanawon, kay ito muna siya, muna di sila magpainit. Ngay, problematic yun, kay na mapikos, yun kita sina, no? Pero we should be out in the sun. If you can't go out in the sun, then you take supplements. Or you can do resveratrol. Sometimes you can buy this. Resveratrol is like metformin. It is an herb that will help your body control triglyceridemia or taas ang cholesterol. Mutabang na siya. ALA or omega-3, alpha lipoic acid and omega-3, you can buy this in the health food store. Or you can eat omega-3. Omega-3 is seaweed, no? And ALA can be taken from seaweed as well. It improves lipid profile and insulin sensitivity. Now, this berberine, you cannot regularly get this. You can ask somebody if you have somebody in the States to get you. But you know, you don't have to take all of these. You know, you can only have 3 or 4, 2 or 3, and it's good already. Pero kung makuha ni mo tanan, di maayo na siya. Berberine, you can get away. You don't need to have that. Well, folic acid, we can always get that in our diet. It's very rich in grains and legumes. And even in greens, you know, grains, legumes. Munang kinanglan mo kaong gyud sakto og vegetables and right grain and fruit and the right food you need because rich na siya in folic acid. You want to have good folic acid because kung mag-pregnant ka that nga diminish imong folic acid, abnormal ang baby. Walay utok or something wrong with the spinal cord. So we really want to be sure because we're waiting on a pregnancy, no? If you're waiting on a pregnancy and then ma-pregnant ka niya, folic acid deficiency ka, ay problematic ang imong baby anak. So, we want to have the best lifestyle good with all the supplementation or eating properly para kung mabuntis ta, anytime mabuntis ta, we have a good nutrition. Now, myo-inositol, you can do that. You can do DCI also, D-chiro-inositol. Maybe this is not available here in the Philippines, but it is improving insulin reception. It's almost like resveratrol, but it's for the insulin. You can buy this, but this can be found in the food we eat. So you don't even need to buy anything here. You go in the sunshine, you eat properly, you can get all this, okay? Supplementation, you can do that in the food you eat. Now, today, in this day and age, they always use complementary and alternative medicine in the management of PCOS. Niya tumagod, medisina diretso. Pero karon ang medicine, the doctors, the OB, the GYN, they already are aware that alternative medicine and complementary medicine is lifestyle. Ginagamit na nila para mag-okay ang PCOS. They said, you cannot be just taking medicine and get well. You got to use natural remedies. You got to use the loss of health. Because if you don't, you probably will have a child, but now not so healthy. And the child can have PCOS also after you. Kaya dapat kailangan, habang gusto mo maging pregnant, you work on it good. You work good. So complementary and alternative medicine now is being used in 70% of PCOS. The doctor say, magbantay na gyud ka sa imong weight, ha? Supposedly, mukhaw na kag-inani. So, involves 3 classes. You have the nutritional, way, tamang pagkain. And then, naapag yun psychological, di ba? I said nga, sometimes, guol kay sila. So, kinahanglan sila cognitive behavioral and physical. So we really need to control all these, or in combination. These are now being used. You should be aware, if you have PCOS, your doctor should be aware that you can do something with nutrition, you can do something with psychological care, you can do something physically in order for you to control PCOS. Now, I don't know whether, this is a picture, this is only a picture, this is not the real thing, but this is Jacob with Leah and Rachel. Leah is carrying a child. Anak man na siya. Si Rachel, walay anak. Dugay na siya ng walay anak, no? But who knows that it was PCOS? But she was looking for a baby. She was asking for a baby. But at least she gave birth to Joseph, right? Yan, nasundan dahil ni Benjamin, yes. Na namatay ba siya? Namatay si Rachel, di ba? Pagpanganak niya. So maybe, this is my own. Don't claim me. But I'm saying, maybe na siya PCOS at to. So, nag-complications ang iyang pregnancy, namatay siya. Basig hypertensive to siya, basig diabetic to siya, basig na siya problema. Munang, you know. And she was like palangga man na siya ni Jacob, di ba? So, who knows? And she died when she gave birth. So, that sometimes, you know, you have to think, maybe the Lord is not giving you a baby. Think twice. Maybe it is His will for you. Sometimes it's really, and maybe the Lord wants you to be working hard for Him. Because if you had a child, you can't work that hard for Him anymore. Kaya dito na yung mga tadyo, akong anak. Ang problema. I know that for sure because my child was a special child. I couldn't work more than I could work because I had to take care of my child. But I bless the Lord. I thank the Lord because, you know, if He gives you the right time and His right way. So, the Lord is good, brothers and sisters especially. Don't be worried when you have PCOS. There is a way to deal with it. But if there's no way to deal with it, which is not right, there is always a way because for every trial we get, there is a solution. God is always there for you. And He says, come unto me, all you that labor and are heavy laden, and I will give you rest. You don't have to worry. Trust in the Lord with all thine heart and lean not unto thine own understanding. Ang dami mo nang alam ngayon, no? Pero lean not unto thine own understanding. In all thy ways acknowledge Him, and He shall direct your paths.
Thank you so much, Doc, for your invaluable lecture. Your knowledge and dedication have undeniably enriched our comprehension of this crucial topic. Kapaglaom, let's now move to our question and discussion. We have some questions here and we would like to take few moments to address them with Dr. Fernandez.
Yes, all right mga kapaglaom, as we start sa itong discussion, I encourage our viewers to share their thoughts, no, questions, and so with reflections sa atong comment section. Together, of course, sa ato ang guest, Dr. Fernandez. And yes, ganina no nakita nato yung lecture. So now, Doc, we have drop comments no sa ato ang mga viewers, and one of the question is, because it's often misunderstood or overlooked, no? How can we break the silence and stigma surrounding the condition to ensure greater understanding and support for those affected?
Oh, it's like this. If, di ba, nagsulti man po ang Biblia nga, my people are destroyed from lack of knowledge. And it's because the people who know do not do anything. And those who think they know do a lot. So then the problem with those who don't know and do a lot, they're spreading the wrong things. But those who know just don't really care. So what really is important is if you're knowledgeable, if you know, share lang. Kaya you are my brothers, I am your brother's keeper, sister keeper, or we are supposed to be accountable to each other, di ba? If we love each other, we will work with each other to get better. So that's why I'm here to share my what I know of PCOS because it's important, no? And imagine ang woman nga murag lalaki na siya tan-awon nga babae man unta siya. That's a very big problem. She'll be very depressed, she'll be very sad. You don't want that to happen, di ba? What if it's your sister?
Yes.
Yeah? So, why not share? Why not share the wisdom and the knowledge?
Thank you so much no mo nang karon mga kapaglaom ato na paminawan ang lecture, and with that pud doctor no dito sa part sa imong nga discussion is na mention ka nga if we have that kanang manifestation
Yeah.
when it comes to the PCOS is kanang mo regular ko anta natay dapat mo go ta into check up. So is it monthly mo adto bagyud ta or kinahanglan ano kung naatay aning nga symptoms dapat mo sana mo donate gyud ta sa ato ang doctor.
And yeah, I think if I were your physician, no, I will because said diba we in the lecture we were talking about kuan man gud na siya related sa diabetes. So you regularly will treat them like you're treating diabetes, no? Type 2 diabetes, kay insulin insensitivity, tapos overweight siya, except na irregular menses, niya na hirsutism. You treat it like diabetes, you know? So lifestyle or medications para when makontrol na yung sugar, makontrol na yung metabolic problem, mag-regular na siya. Then kung gusto gyud na siya nga she wants a pregnancy, then you have to have her plot her menses na dayon. It's not really that hard actually. It's a lifestyle thing, manggod. It's the same way as before they would say diabetic ka, forever diabetic na gyud ka. It's not true because lifestyle can reverse diabetes. The same way as lifestyle can reverse PCOS. It's just that, you know. Lifestyle is very important, very powerful.
So nindot kay nga punto dai Doc no nga imong butang gihatag information kay with that ato bitong ma-avoid ang greater or higher risk sa usa ka babae no sa usa ka tawo. So ang problema man go Doc is sa atong panahon karon nga murag muhatag sila og attention dito na lang sa in the middle part
Kung ano
or
ba?
in the worst part.
Yes.
Oo.
Yeah. That's why we as women, we're mothers or aunties, na ganitay mga pag-umangkon nga nagamanifest na aning mga, you know, just a hirsutism, irregular menses, weight gain.
Muna na siya
Oh,
nga
muna
dapat
ng
unta.
signs. Patanaw na daan so that dili na mahimong full-blown PCOS na siya.
Yes, that's it.
Yeah.
So, munang, yes, Doc.
Ibi kasi manggo, di ba, nakita nimo sa ultrasound daghan mga bilog-bilog, mga cystics, kana mga eggs man to siya, mga follicles to siya. Dili na tumubalik. Di na to siya mahimong dili na siya makakuha na to. She's not going to ovulate from those cystic eggs anymore. So sayang na to. You know, you have an amount of eggs when you get born, you know. And then every man says magdako na siya, only one will be tapos ang uban mawala na lang na siya. So kung sige kag cystic ka, ang imong mag-grow tapos mamatay, mag-grow tapos mamatay, ana na siya. You don't have any more pundo. Mahurot og dali bisag wala ka nagregla, mahurot imong itlog. So you don't want that to happen so that you have enough follicles to ovulate.
Right. So, mo gyud ang dako kayong punto mga kababayan no? Napaminawan nato ang punto. And of course, ito sa lecture, dako kahit ang nakatunan ato. And then, with that, Doc, gusto nato po i-point out sa mga kaubanan nato or mga kababayan no? If, unsa ba yung needed nga food to avoid or to kanang ma-assist nga dili ka mahimo o ma-prone ana ang PCOS.
Okay. Regularly, magud, it's not only food that you're going to use, right? You have to be exercising, sleeping early, yan, out in the sunshine, get your vitamin D, and all the rest of the other health tips, no? Pero kung for food, it's as much as possible, dili gyud ka buras ka sa refined grain like white rice or white bread or
Temperance.
quick cook oats, mga ano niya, daghan kayo imong kaon, i-control yun na siya so that you don't have too much, and then no high calorie foods, not fatty, not mga so very fatty and very sweet, and mga eat right lang yun, and vegetables and fruit.
Alright.
And what
So
can I
it
say?
goes-
It's
it-
simple actually.
It will go down, it boils down to marabitaw lifestyle, correct? Right? Lifestyle,
Exactly,
Doc, no?
yes. Intemperance man good can push you to PCOS and will push you to PCOS. no
Ano
matter.
na lang ka na, Dok, no, kay dili man gud tanan same og mga work and most especially women karon kay nag-appeal na or nagsulod na og kanang night shifts ba na so regular ingon gani ka na mention is kanang regular ilang nga sleep. So isa na siya nga kung once nga ay mong work is panggabi and then
Na-disturbo ng system.
aside pag yun ana kay instant na ang food and then kanang sa tawag na kanang sa mga fast food like anana na lang mga food. So mo na siya mo go into problem. Dili ba kakaingon nga exempted ni siya?
No, you
Very
cannot.
good.
You really need, you know, kung your circadian rhythm regularly magyud no and normally is affected by light, you know. So since you're working at night and you're sleeping during the day, you really have a problem, you know. But
Okay.
we cannot
Ay,
do
naku,
anything.
Mando.
They work at night, no? So let's wake. You have to find a way. So what you do is you sleep during the day with closed curtains, yun na siya. Dark yun imong room. You simulate the nighttime, okay? And then when you are awake, when you're sleeping during the day, close good, no? Tapos when nighttime, if you have sleep problems, you use the white light. You know, you have to use white light in your house. Tapos some of them, then there are also the red lights, you know. So use white light when you're awake, and then just before you go to bed, you use red light. Kaya relaxing man siya. So you have both red light and you have white light. Kung gikan ka sa trabaho, white light man na sa hospital, no?
Yes.
So pag uli mo sa imong balay, red light na siya. Kay kanang red light mo kuha na siya mo pa-relax sa imo para pag tulog nimo, dark imong curtains, you will get it. You will get the good sleep.
That's a good idea, no?
Yeah. Because if you sleep with open curtains or window with very light curtains, you can't, kasi bisag sarado imong mata, you can see light. Light will go through your eyes.
Yeah.
So that's why sometimes they use this, like that, yes. But it's easier lang na dark curtains, good, para wala good kay kuan. Yeah.
Isa na mga point kailangan din nato i-take note kapag laom Ray.
Okay, thank you. But Doc, the impact of PCOS or PCOS extends beyond its physical symptoms. Our next question, Doc, is what are some of the common challenges that individuals with PCOS face, and what are the keys to empowerment for those navigating this condition?
Oh, it's very common because these women usually, they go to the doctor and they are diagnosed kay tungod wala sila nanganak. I mean, they've been married for some time. Unfortunately, in our culture, we really don't really care about regular menses. Murag okay lang sa ato nga walay regularly. But then you go to the doctor now because you want to get pregnant. Yeah, yes. And then usually magud sa infertility, ang girl ang na-fault. That's what we think. Okay? And so the husband would say, pagpatanaw dito, ikaw, lalala. And it's the stigma is the girl is at fault. So if labi na dili regular iyang menses, so na depression, na ay unwantedness, na ay feeling of helplessness. The girl is like na
Mas misamot hinoon.
yeah, on top of all this plus pag yun nga ang iyang hormones ga sa kanaog, and then predominance of one hormone over the other with imbalances can cause these problems to start with. So majority of these women wanting pregnancy is problematic na sila. They really want to have children, but unfortunately, then they can easily go to premature menopause. No,
Ay,
yeah.
ganun. Look, they know.
Yeah,
ba?
pwede mag-premature menopause sila.
Pwede day manana. Mo rin always nakainomdom ko sa mga OB ba na isa nag-story siya na nga kailangan yun day correct because sometimes na mga early times of
Yeah.
ganana.
On top of that, you can have osteoporosis, you know, because estrogen mango is like the bus that helps calcium enter the bone. So kung wala kay estrogen, then your calcium is not brought into the bone efficiently. So kaning mga PCOS, mga osteoporotic na sila. And because they very early osteoporosis, ang skin affected, ang their heart is affected, kay the softness and the pliability of the blood vessels are affected by estrogen. Wala siyang, hindi siya, yes.
Complication na, Doc, no?
On top of that, hypertensive pa siya, kay tambok siya. O di daghan na kay, muraragyapon siya nag-stroke, muraragyapon siya diabetic, muraragyapon siya hypertensive. So, and then it's just because the ovaries are like that, you know?
Ang worst po diha kapag laom kay kanabitong aside sa kanabitong na overlook niya iyang sitwasyon, aside ana kanapag yung sitwasyon nga wala sila bitaw, they don't have the finances to support nga
Yes.
magpaadtog magpa-check up sa doktor. So how could they know sa ilang sitwasyon, no? So worst nga part na nga aside anang kwan wala sila kwan ba wala sila kwarta nga makapa-check up. So ma-check ilang kondisyon.
Are there no government like things like that? So you can go to government hospital and have yourself checked. But it's like this. The miraculous work of the Lord.
Okay, that comes,
Yeah?
Yes, that's right.
Every time you follow the laws and the statutes, simple, your body will follow man good. Because these are man good you do this, you do this, you do this, you do this,
Sakto.
and I will give you health. But if you don't, that's why because luoy po ang pobre, no? Wala sila adtuan. You think the Lord will look away from them? No. No.
Yes, so maunang dako kay nga punto. Thank you so much, Doc. And ato po day add up no kani pong kay nag-add na yung kanang bitong mga wala joy finances. Pero naa sila ang resources. Pero wala lang sila kabalo sa ang paggamit. Oh, mao na
That's
siya.
it. So
Information.
we can you give out information of lifestyle like this
Like
also,
this, yes.
so that they will be made aware.
So I think sa ang ato po mga barangay, I think mga barangay health workers nato. I think with that naghatag po sila og mga pamaagi pod ba. So atong ato ring gidasig nga atong mga kababayanan nga kung aduna may mga health lectures atong mga barangay, join and attend so that you will also be able to learn many things para sa inyong health.
What is amazing is ang kitang mga medyo in the middle income and high income were the ones that are hit with PCOS. Ang mga pobre dili. Kaya
Yes,
nga,
no po, no,
they don't suffer from it because they're out in the farm working, they're eating vegetables. They hardly eat a lot of salty
Pwede man-
fried food. No.
Lauoy.
Yeah, laoy lang. Oh,
So,
So,
how
isa din
that's
na
how
siya.
it balances the nature.
yeah, the
no?
vegetables, yes.
Oo.
Alright.
Yeah.
So isa po Doc no sa punto dito na mong na-mention dito sa to ang lecture ka to nakita ganina is that if dili gyud siya ma-manage, naman day possible nga magkaanak, naagya po sila baby, but it comes to complicated or di ba it's successful. And dito ko na iguusa katong ingon nimo nga sometimes ang bata sa to
Ma-affected.
dako gamay siya, no? O gawas.
Yeah,
Or
kay
sometimes-
preterm,
Yes,
yes.
preterm. And then na possibility nga usahay or dako ba ang
Dako
bata?
kaayo.
Oo, ana kay naka-try jud ko because akong cousin is really gid siya dugay pud siya, PCOS pud siya. Pero gingnan ko niya ay maburos pa pero tinuod jud na kay ang iyang baby karon gamay gid siya. So in ko mo din ni ang
Yeah.
sa lecture
Yeah.
makapaglaom. Kung di gid din nato makorek is makita nato ang result.
Yes.
Oo. Then pausa to Doc ang kaning bata unsa na puy kuan niya it would be also kanang possible pud ba nga
Yeah,
Mag-grow
second
up siya.
to third generation.
alright so
Kasi
naari
may
na-
epigenetic check mangguna siya. The genes of the baby will be shifted towards like the lifestyle of the mother. And then if the mother doesn't check it, it will definitely go to the child. So, that's why nga if you make a mistake, it goes to the second and third generation and more if you don't fix it.
So mga babae.
Muning gitawag nga epigenetics.
epigenetics
Hindi
alright.
dili siya kalahi,
Epigenetic,
pero
okay.
na-switch during pregnancy.
Pero how about kung ang iyang anak nag-change og lahi na ang iyang lifestyle na
Yun, di ba nag-ingong ko, our genes are the bullets in the gun,
Okay, yeah.
but lifestyle is pulling the
Ah,
trigger.
alright.
Oh.
Yeah.
so mao to makapaglaom no mo na ko kayong punto nga sa to ang take note.
So, ang mga ginikanan, ilabi na ang mama rin, no? Si Eve. Na
Yes,
siya dakong
yes.
responsibilidad sa pag-umol, sa iyang pagkatao, usab sa iyang bata pohon.
So
Kay
importante
it will
kay ang si Eve sa iyang pagkabuntis will not only affect her daughter but her granddaughter as
Generation.
well. Yes, yes.
Generation.
So imagine that as women wanting to get pregnant or hoping to get pregnant, we have to think yun nga ang atong mga actions karong buntis ta or dalaga pa ta, mo-affect yun ni siya sa atong apo nga babae. Okay.
Alright.
Doc, we have also a follow-up question here. If a woman is overweight, will losing that excess help her to become pregnant?
Yes, very, 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 what they call this, very markedly. Bisag 10 pounds lang gani, it will already fix a little bit the insulin insensitivity. Tapos, kasi pag nagamay ang hawak, dako na kay na nga kuan, nga help in the metabolism. So, 10 pounds lang gani ang imong malus, it already affects your insulin insensitivity.
Very well. And then, isa pa po, Dave, Doc, no? Isa sa tong mga, kay di man doon mahibalaan nga na PCOS. How about ang ato ang mga kapaglaom nga kanang gusto nila ba or nagatake na lang sila og med para lang mahimo silang same like boys, like patubo ba silang mga kuan? Do they have also kuan ka ng chances nga mahitabo po ni sila nga naa sila ani kaning PCOS?
But PCOS is not man good drug induced. It's not regularly drug induced. But if you're a woman trying to take testosterone, she will definitely not have menses. She will definitely look like a boy, like what PCOS manifests with. Yes, it's the same thing.
So mo gyud na mga pag na-speechless mi ato sa mga sa mga punto nato mga kapaglaom karon nga buntag.
Okay, thank you so much, Doc. Our time together has been enlightening. This time, mga kapaglaom, let's hear from our WMC Health Director for his spiritual health tips.
Mayong adlaw kanatong tanan mga kapaglaom. Alang sa atuang spiritual tips nining atuang programa The Christ Farmacy, ang Dios dili gyud magabiya kanato mga kapaglaom. Ilabi na sa ato mga viewers karon nga dunay gipambati. Ilabi na sa ato nga topic sa premenstrual syndrome nga dili nato usahay masabtan ang lawas. Ilabi na sa ato ang mga kababayen-an. Apan ang Dios andam siya nga mutabang kanato. Ilabi na sa ato mga kababayen-an nga dunay mga gipangbati gayud ug dili nila masabtan ang ilahang lawas. Naa ang Dios nga nagdisenyo niini ug andam siya nga muhatag kaninyo ug kaayuhan. Gani ang Dios nagasaad dinhi sa Psalms 29 verse 11. The Lord will give strength unto His people. The Lord will bless His people with peace. You see mga kapaglaom, ang Dios di ay maghahatag kanato sa kusog. Kita iyang mga katawhan. Kung ato siyang gituhan ug ato siyang gialagaran, dili di ay kita mabalaka. Doon na may mga kakulian sa ato ang lawas, doon na may gipangbati nga dili nato masabtan, apan ang iyang saad sa balaang kasulatan, nga mohatag siya kanato og kusog, ngadto sa matag usa. Ilabi na sa ato ang mga kababayen-an. Mohatag siya og kalinaw. Let us remember, sa usa ka babae nga nagsakit sa panahon ni Ginoong Hesus, sa diha nga duna siya dako kayo nga pagtuo, giayo siya ni Ginoong Hesus. Maingon usab karon sa atong moderno nga panahon nga duna kitay dili masabtan sa atong lawas, but we have peace in God. Kung muduol kita kaniya, He will strengthen us. Naingon diri iyahang ligunon ang iyahang mga katawan. So kapag laom muduol lang di ay kita ni Ginoong Hesus. Ug kining atong mga gipangbati sa ato ang lawas, ato kining itugyan kaniya kay siya magahatag og kaayuhan niini, magahatag og kaalam, kahibalo nga masabtan nato atong lawas aron ato siyang madayeg ug mapasalamatan. God bless us all.
Thank you so much, Pastor, for inspiring spiritual health tips. And this time, alang sa atong pagtapos, let us hear and give the time to Doc Fernandez sa iyahang nga takeaways.
Mga kapaglaom, and everybody out there, kapaglaom tang tanan, we were hoping for the best for everybody. Unfortunately, we live in this world, and the only way we can really make things better is to follow the word of God, and be aware that our bodies work in certain ways and suffer in certain ways. So, the easy way out really is to just think that when you follow what God wants you to do, you get better. If not, you get worse. So PCOS is really a lifestyle thing. One lifestyle can be fixed with proper life, our lifestyle problems can be fixed with lifestyle interventions. It works. It really does. So I cannot say anymore. It's just like that. Because the Lord gave that to us. Weak manggod ta, di ba? Sinful ta. There is supposed to be easy situations for us to get back when we suffer from sin. We cannot even do it on our own. We need the strength of God, di ba? So nga nung palis dun man taniya, nga kabaluman siya nga we're having a hard time. So that's why when we need help, we just go. Lord says, come to me, I will help you. I'm here. You're heavy laden, you feel bad, I'm here. He's always there.
Okay, Doc, with all the knowledge and information you have shared to us, we are all blessed.
Yes.
Oh, praise the Lord. Also me.
To God be all the glory, mga kapaglaom. Ang among pasalamat ug kalipay sa inyong pagpakig-uban kanamo sulod sa usa ka oras sa pagtuon sa maayong panglawas.
Yes, and daghan kayong salamat mga kapaglaom. Usab magkita-kita na pod kita next sa mga next nga higayon mga kapaglaom. Alang sa ato ang anindot na usab nga topic. Tune in with us again from 11 a.m. to 12:30 p.m. diri lang sa ato ang programa
The Christ Pharmacy, the key to health and vitality.
What will your last 10 years look like? Will you be quick enough for a game with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide. The average people will spend their last 10 years in sickness. Change your future that will make your health last. Here on The Christ Pharmacy, your key to health and vitality.